Hi everyone, welcome back. I'm going to be honest, as a med student, I hated embryology. Too many lists, too many complicated diagrams without actual explanation. So my goal in this video is to take this complicated topic and break it down into bite-sized chunks. And by the end, hopefully, all this stuff that seems like mumbo jumbo in the beginning should make a lot more sense. Let's get started. All right, so first things first, embryology is pretty much just a study of which structures in the embryo are going to give rise to which organs. And in this video, we're going to be learning about the embryology of the reproductive or the sex organs. And so I'm going to break it down into two parts. First part is we're going to learn about what the actual differentiated reproductive organs are in the male versus the female. And then number two, we're going to match those with the embryonic structures for each of those organs. We're going to do the gonads and internal genitalia. And at the end, we'll wrap up with the external genitalia. Okay, so let's start with part one, which is to learn the differentiated reproductive organs. And differentiated means that these organs are either male or female. And once we know these, then we can look at the structures in the embryo and see where each of these came from. All right, so let's start with the reproductive organs in the male. So genetic sex means what's the chromosome, and in this case, it's going to be XY. Gonadal sex means what are the gonads, and in this case, it's going to be the testes. And then phenotypic sex refers to the genitalia. We can break down genitalia into internal genitalia, which is inside the body, so not visible, and then external genitalia, which is outside the body, so visible. So if we start with the internal genitalia, we have the ducts and the glands. And the ducts are what the sperm travels through after it's made. So let's take a look right here. Sperm is made in the testes, starts off in the epididymis, so that's our first duct. Then from there, it's going to go into the ductus deferens, also known as the vas deferens, and that's going to loop around over here. And back here, the ductus deferens is going to connect with the seminal vesicles, and then together they're going to be called the ejaculatory duct, which is then going to connect to the urethra, and that's going to enter the penis and then eventually exit the body. And then the glands, we have two of them. So there's the prostate gland and the bulbourethral gland, and you can see they're both kind of sitting here in the base. And the job of these is to secrete content into the semen to help out the sperm along this pathway. And then the external genitalia is mainly the penis, and the penis has a shaft or a body, as well as a head or a glans, and then the scrotum, which is this portion right here, which houses the testes. All right, so now let's look at the differentiated reproductive organs of the female. So the genetic sex here is XX, the gonadal sex is ovaries, and the phenotypic sex is the genitalia, which are once again internal and external. And the internal genitalia, again, just like we saw in the male, are ducts and glands. The ducts over here are the fallopian tube, which are out here next to the ovaries on either side. And then the fallopian tubes meet at the center. So the next structure is the uterus, and then the uterus continues to become the cervix, and then the cervix connects to the vagina, and the proximal part of the vagina is part of the internal genitalia. And then there are two glands, the Bartholin gland and the Skene glands, and these are very important for making secretions. And then the external genitalia here is also known as the vulva, and it has three main parts. It has the labia, which is the labia minora and majora, the clitoris, and then obviously the distal portion of the vagina. Okay, so before we move on to the next part, let's do a quick recap of the differentiated reproductive organs between the male and the female. So the genetic sex in male is XY and female is XX. The gonads is testes in the male, ovaries in the female. The internal genitalia are the ducts and the glands. So in the male, the ducts are the epididymis, the ductus deferens, the seminal vesicles, and the ejaculatory duct, and the glands are the prostate and the bulbourethral gland. The bulbourethral gland is also known as the Cowper's gland. In the female, the ducts are the two fallopian tubes that unite into the uterus in the center, which then becomes the cervix, which then connects with the vagina, and the proximal portion of the vagina is part of the internal genital tract. And then the glands in the female are the Bartholin glands, which is also known as the greater vestibular gland, and the Skene gland, which is also known as the urethral and periurethral glands. And then finally, the external genitalia in the male are the penis and the scrotum, and the external genitalia in the female are also known as the vulva, and that contains the labia minora and majora, the clitoris, and the distal portion of the vagina. Okay, so now that you learned about the reproductive organs, let's move on to part two, which is the embryonic structures that gives rise to each of these organs. So by the end of this part, you'll know what these embryonic structures are called, and you'll know exactly which structure gives rise to which organ. All right, so let's start with the internal organs, which are going to be the gonads, and the internal genitalia, which are the ducts and the glands. And so let's start over here. This is our embryo. So this would be the right side, this would be the left side, and this is the top, and this is the bottom. So right now, all these sex organs are undifferentiated. That means that they haven't become male or female yet. So the first thing you have to know at this point is that all of these internal organs, so all of these gonads, ducts, and glands, are going to come from one of two regions in the embryo, either the urogenital ridge or the urogenital sinus. So everything is going to come from either one of these two. And why is it called urogenital? Because these parts are going to give rise to structures that are going to turn into part of the urinary system, so uro, or part of the genital system. So all the internal urinary and genital organs are going to come from these two regions, the urogenital ridge and the urogenital sinus. Okay, so now we know that, but the next question is obviously, well, how are they then different from each other? So let's start up here, which is the urogenital ridge. So that's everything up here. And here, this part is going to give rise to 4 important structures on each side of the body. So a total of 8. So the closest one to midline is number 1, which is the gonadal ridge. So this is the undifferentiated gonad. So when sexual differentiation happens, this is the part that's going to become either the testes in the male or the ovaries in the female. Now, just lateral to that is number 2, which is the mesonephric or Wolffian duct, and again, 1 on each side. And these ducts are going to turn into the male genital ducts. Remember that these male genital ducts are the epididymis, ductus deferens, seminal vesicles, and ejaculatory duct. And by the way, here's a good mnemonic. You can rearrange the starting letters here, and it's going to spell the word seed, S-E-E-D, and that'll help you remember the male genital duct structures. So that's structure 2 right here. This is going to give rise to the male ducts. So then just lateral to that is structure 3, and this is called the paramesonephric or the Mullerian duct. And so these are going to turn into the female genital ducts, which you remember from before are the fallopian tubes, the uterus, the cervix, and the upper part of the vagina. So that's structures 1, 2, 3. And so we've covered all the genital structures of this region. But remember, this is called the urogenital ridge. So that means that we have to have urinary structures as well. And that's number 4. So structure number 4 right here is called the metanephric kidney. And these are going to become the kidneys. Now in this video, we're mainly focusing just on the genital reproductive structures. But I just mentioned this as well, just to be complete. And so you know all the structures that are in the urogenital ridge. Okay, and so now let's talk about the urogenital sinus, and this one's much easier because there's only a few things left since we already accounted for the gonads and all the genital ducts up here. So the only genital structures that are left are the genital glands. So in the male, it's the prostate and cowpers, and in the female, the Bartholin and Skene glands. And additionally, the distal part of the vagina in the female, because remember that the Mullerian duct up here only gives us the proximal part, so the upper part of the vagina, so the lower part then comes from the urogenital sinus. And then the final point, just to be complete, again, we're not focusing on the urinary structures in this video, but remember this is also the urogenital sinus. So the rest of the urinary tract also comes out of this region, which is going to be the bladder and the urethra. But the main takeaway here regarding the genital development is that the gonads and the ducts are going to come from the urogenital ridge, and the glands and the distal vagina is going to come from the urogenital sinus. All right, so now I'm going to show you what this is going to look like as the undifferentiated embryo differentiates into either a male or a female. So this is our structures in the urogenital ridge, urogenital sinus, and I've just added this external genitalia, which I'll talk about in a couple of minutes, but let's just focus on recapping what we've talked about. So first thing that's going to happen is that our undifferentiated gonad in the gonadal ridge is going to differentiate. So let's pick the male side. So it's going to become the testes. And what happens with the testes is that they actually descend or drop. So the testes have dropped down here. And then what this is going to do, the testes are going to promote the mesonephric or the Wolffian duct to develop and become the male ducts, which are the epididymis, ductus deferens, seminal vesicles, and ejaculatory ducts. And since this is a male, we no longer are going to need the Mullerian ducts, right? Because these are going to give rise to female structures. So the presence of testes is actually going to cause these ducts to go away. So they're not present here. And then the final thing is that the structures of the urogenital sinus are going to give rise to the glands here, which are the prostate and the Cowper's glands. So that's the male. Now in the female, we can kind of follow the same logic here. So we have our gonads, and in this case, the gonads are going to become the ovaries. Because this is a female, we're not going to need the mesonephric or Wolffian ducts. So those are going to go away here. So that's not present here. But the paramesonephric or the Mullerian duct is going to develop because that's going to turn into the fallopian tubes. So we have two fallopian tubes here, and then one uterus, one cervix, and the upper vagina. So the one thing that's different here in the female development is that the structures of the Mullerian duct are actually going to fuse. So everything below the fallopian tubes, which is the uterus, the cervix, and the vagina, are going to fuse in the middle. And so we only have one of these structures where we have two fallopian tubes. And so this is different than what we saw in the male. And then the urogenital sinus structures are going to turn into the glands, which are the Bartholin glands and the Skene glands in the female. And then also remember that this is also going to account for the lower part of the vagina. All right, so let's very clearly summarize the reproductive structures that are going to come from the urogenital ridge. So let's start in the embryo. So our undifferentiated structure, number one, is the gonadal ridge. So in the male, it's going to turn into the testes, and then the female, it's going to turn into the ovaries. Then next, the mesonephric, aka the Wolffian duct, that's going to develop in the male, and it's going to turn into the male genital duct structures. But in the female, it's going to resorb away, and so after birth, only a little piece of remnant is going to be left inside the body, and that tissue is called the Gartner's duct. And then finally, in the paramesonephric, or the Mullerian ducts, we get the opposite. So in females, it's going to develop, and it's going to turn into these female genital duct structures, but in the male, it's going to resorb away, and after birth, the remnant of it is going to be called the appendix testes, which is a little piece of tissue that's attached to the top of the testicle. And these two remnants, Gartner's duct and appendix testes, are not functional, so they don't actually do anything. They're just leftover tissue from the structures that resorbed in the male and the female respectively. But sometimes test questions like to ask about them. So what you need to know is that Gartner's duct is the remnant of the Wolffian duct in females, and the appendix testes is the remnant of the Mullerian duct in males. All right, and so now let's also do the same summary, but this time for the reproductive structures of the urogenital sinus. Now remember, the main things here are going to be the glands, and these glands are homologs of each other. So what this means is that the tissue in the urogenital sinus that turns into the bulbourethral gland in males will turn into the Bartholin gland in females, and the part of the urogenital sinus that turns into the prostate gland in males will turn into the Skene gland in females. And knowing these homologs is pretty high yield for test questions. So when you're doing Anki, for example, you're going to see cards that will name one of these glands and ask you, what's the homolog for this one for the other sex? So what you need to know is that these glands all come from the urogenital sinus, and the homolog pairings are a bulbourethral with Bartholin gland and prostate with Skene glands. All right, so we've covered all the internal genitalia. Now the only thing left to talk about is the external genitalia and their embryonic ancestors. And before we do that, here's a quick reminder of the main external genitalia. So in males, we have the penis and the scrotum, and the penis is made up of the head or the glands, and the body, which within it has the erectile tissue and the penile urethra. And then the female external genitalia is called the vulva, and its main parts are the glans clitoris and the labia, which has the labia majora and minora, which surround the vaginal opening. Now let's see how these all start off in the embryo. All right, so I know there's a lot going on here, but don't worry, I'll walk you through all of these. So just like we saw with the glands, the external genitalia also have homologs in the female versus the male. And so what this means is that we're going to start with this undifferentiated, and then we're going to learn these key structures, and then we're going to see what each of them become in each sex. So let's start right here in our undifferentiated embryo, external genitalia, and there's three important structures to learn here. We have the urogenital folds, we have the labioscrotal swelling, and then the genital tubercle. So the urogenital fold is actually a fold that wraps around in the center here, this opening. And then just outside of this urogenital fold is the labioscrotal swelling. So this labioscrotal swelling kind of wraps around the urogenital fold. And then finally at the top, we have the genital tubercle, which is this prominent tissue that's above both of these. So now let's see what's going to happen to each of these structures in the male versus the female. So let's start with the genital tubercle. It becomes two things that are homologs of each other. So first, it becomes the glans penis in the male. So that's the head of the penis, and the glans clitoris in the female. So that's the top or the head of the vulva. So here's the genital tubercle. There's the glans penis over here, glans clitoris over here. So pretty much the glans penis and the glans clitoris are homologs of each other. They both come from the genital tubercle. But the genital tubercle also becomes the erectile tissue in both male and female. So in the male, it becomes the corpus cavernosum and corpus spongiosum, which are the erectile tissues in male. And then it becomes the vestibular bulbs, which are the erectile tissues in the female. And so these two are homologs of each other, and both of them come from the genital tubercle. Now, next is the urogenital fold. So in males, this fold is actually going to fuse and it's going to form the penile ventral shaft, which is going to kind of wrap around the penile urethra. And this is why the penile urethra is not visible until the very end at the tip of the penis. But on the other hand, in the female, this urogenital fold is not going to fuse. It's just going to remain open. And so it's going to form what's known as the labia minora. And so the ventral shaft of the penis, which contains the penile urethra and the labia minora, are homologs, and they both come from the urogenital fold. And in the male, the urethra is encased by this ventral shaft, whereas in the female, it's exposed within the labia minora opening. And then finally, we have the large prominent swelling on the outside, which is the labioscrotal swelling. And here the name kind of is going to give it away, right? So labia, so it's going to become either the other labia, which is the labia majora, or it's going to become the scrotum. So once again, in males, this swelling is going to fuse, and so it's going to come together to form the scrotum. And in females, it's going to remain unfused, and it's going to form the labia majora. And so the scrotum over here and the labia majora over here are homologs, both coming from the labioscrotal swelling. Okay, that's it and that's all. Now that you learned what the embryonic structures are of the reproductive tract, the next step is to learn how they differentiate into either male or female organs. It's another super high yield topic, and I'll link the video here so you can check it out. But if you guys enjoyed this video, please hit that like button, share it with others. Also make sure you're subscribed so you don't miss out on new videos and quiz posts. But for now, thank you for watching. I'll see you next time.